Thank you for agreeing to participate in this final evaluation of our patient exam room. We invited you because you probably participated in previous phases of our study. What I'm going to present to you today is the final iteration of the simulation. Based on all the feedback you've given us in previous phases, especially the simulation-based evaluation that we conducted some months ago, we made some adjustments and now are prepared to show you our final iteration. What I'm going to show you today is our mock-up here at Prisma Health, and I'm showing you a version of the mock-up that we call tape on the floor, meaning that we use tape to make some adjustments and show the modification from the previous phase to the new one. Ideally, you could come up over here and see it for yourself. It's on the same space that it was installed before. But if you can't come, we're gonna prepare this video where I'm gonna show you step by step everything that we changed. Hopefully this video will be enough information for you to make your assessment and respond to the survey afterwards. If anything, you can also reach out to us and we can discuss those changes and you can give us further feedback. Now, without further ado, I want to show you the first thing, which is a comparison side by side of the different floor plans. So this is our previous exam room, and this is the revised room, right? And the first thing that I want you to notice is that now the room has a smaller size. We resized and reshaped everything, trying to accommodate the workflow and yet having a more compact patient exam room. For many people mentioned that the previous version was maybe too big if in comparisons to a common emergency department patient room. So it used to be 13 feet and 5 inches. Now it's 12 feet and 4 inches. And to this side, we also reduced from 15 feet to 14 feet, 7 inches. You will also have a copy of this floor plan at hand to use it when you are responding to our survey. Down here, we have some of the comments that you provided and how we address those comments, and always thinking about improving the room in terms of safety, efficiency, and experience. Let's go outside a little bit so I can show you some of the changes that we made outside. So one thing is that we don't have a sink inside the room anymore. The sink will be moved outside. Potentially, it could be installed right over here, right? Next to the observation window into the room. Before, you used to enter the room from this side, but now we also flip the entrance. So as you can see, this is the main entrance of the room. The door will slide this way. You enter here, and we have the hand sanitizer, the gloves, and the masks outside the room. This minimizes the amount of things that you need to remove from the room when ligature minimizing it. The provider or nurse, the caretaker will come from this side, use the hand sanitizer to wash hands. We don't have a sink inside anymore, again. Or if they want a sink, the sink will be outside in the hallway. Another thing that we did is we angled both corners of the room. Previously, we had that angle over here. Maybe you can record it. And now we also have an angle at this side with the observation window. This was installed to try to minimize hiding spots, especially hiding spots associated to the family bench that I'm gonna show you shortly. Once entering the room, one other thing for you to notice is that we now have a nurse call button and a light switch over here. The idea of the light switch is, since we have a lot of environmental settings that the patient can control, they can turn different light colors, blue, green, red, different projections, different things. If there's a clinical emergency, the provider could come and badge the light switch, which would put everything back in a clinical setting, like bright lights, focused on the patient, no projection, and turning the music off. So this is the quick light switch for clinical purposes. And we have the nurse call button right next to it. Here is our storage. Before we had the storage being a swing door, And now we are going for a roll-up door, right? So we don't have a roll-up door here, but just imagine that you would be pulling it up here to access everything that's in the storage. Storage is slightly smaller, but it doesn't really affect what you can fit into it. You can still fit the IV pole and the procedure cart. You can use the procedure cart from here if you don't want to remove it from the storage. We have space for linen. We have space for the IV pole, and the sharps container is right over here, right? Now, no, we didn't make any changes to our media wall. It's still over here. Head wall had a lot of changes. First of it, it's not gonna be a swing door anymore, it's a sliding panel. So this door will slide from here to there. We made sure to reach out to manufacturers who can make that ligature minimized thing. So we are working together with them to figure this out, but the idea is that we're not gonna have anything protruding out of the head wall this time, so it doesn't affect workflow. We also doubled the amount of things that we can store at the head wall. We have now those storage baskets, and in it we can place PVM bags and all the emergency supplies that are needed. Different sizes. It's enough to fit at least like 3 PVM bags here, plus more medical equipment. And we can put it over there as well and have it like twice as much to have for safety reasons. We have a tiny sharps container over here, some temperature otoscope also here, and both of the head walls are now are deeper in a way that you don't need to remove anything from the head wall when ligature minimizing the room. Just sliding the door. Here is the emergency button for patients and family members. One thing about this emergency button is that it has a key. It can be deactivated in case the patient abuses it. So right over here, some changes to the family zone. So one thing that we did is that the family zone was a little bit deeper than this. So we made it more, where we resized it, it's a little bit smaller now. So we have less hiding spots, right? And we are also adding the observation window, which will look straight, you can record that, which will look straight into the family room. We are curious and excited to hear a little bit about your feedback. And again, as I said before, feel free to reach out to us in case you have any questions and need more clarification. Thank you.